Larry Goldstein.
He's the head of the stroke and pain clinic there.
Stroke
prevention.
So we went to him to get a second opinion before he had the heart surgery to say, if we do this, will it really help prevent stroke? And he said, well, let's just eliminate some other things it could possibly be. We're going to take 11 vials of blood and do all this test stuff. He didn't mention that it was a genetic test or anything, and then our experience after that was pretty negative, I'd have to say.
I'll get in touch with my niece and see if it's the same doctor I do. I know it was at Duke University.
Does she live in that area there?
She lives in North Carolina. I'm not sure where. Do you know where Sam is? I don't know, but she actually works at Duke University.
Oh, well, the geneticist we worked with, a genetic counselor who we worked with after the fact, was very helpful and had experience with several families. So they were much more understanding and helpful and hopeful than any physician who just said, "Yes, you've got this. There's no treatment." But I do.
They're actually following, the geneticist there is following 3 or 4, if you include us, families that have CADASIL of varying ages as well. So, but one of the sad things that I'm looking for right now is obviously whether or not it's beneficial to have the BFO closed, given the fact that I'm susceptible to strokes, or if it is a good thing to get it closed related to having CADASIL. Return to that. So.
Well, maybe we can have a discussion on that a little later on.
And as a result, his father tested positive.
I was just going to ask, anyone older than you?
Yeah, my father tested positive for it, and he is having, and has been having for the past 10 years, a lot of the classic symptoms. He is 60. He's 69 now, and he has what I would call moderate to severe gait problems, walking, balance, memory problems, staring. So it's I think he's really got his severity. I've seen it increase over the years.
Do you guys have one?
I have a brother, and he's not tested. Doesn't really show any symptoms. He's never really had I've always had the headache problem. That's why I ended up at a neurologist years ago. And he really never had that indication of that at all. My great grandfather, or it would be my grandfather, is where we are pretty sure that CADASIL came from, and he actually died at 79, but he died of symptoms. Actually, they called it hardening of arteries back then, and but he died of the classic symptoms, a series of strokes eventually. It all matched up. I mean, I'm pretty sure that's.
My sister had no symptoms either, but she was tested and has it. So it's, because of my parents being 80 and 83 now and doing great, very good, really good health. And Ed Nunziato, who's an assistant to Dr. Sape at NYU, I was emailing with him, and he told me that it's rare, but it is possible to outlive your symptoms. So to have a mutation, but outlive the symptoms, and that's what we're kind of hopeful for with my sister, and it could be true for your brother also.
Well, that's a question I had for the doctor, was that that their apparently mutations are different, and that they have different effects. People can have one that's more severe, will come on quicker and stronger.
Right.
Some have mutations that will take many years to come on.
But within your family, it's the identical mutation, yet it can
Well, that's
still.
my question. I've been told that you can't really look at within your family. That it varies within your family. But
I
again, I'm
think
talking.
that points towards probably environmental factors.
Maybe so.
Have something to do with.
Because when they look for the mutation in your blood, they look at the same exact spot as the previous person. So the mutation is in the same place, I believe, on the 19th chromosome, is the way I understand it.
Between the family.
But yes, within your family. And that's why it's so cheap for a second person to be tested, like through Athena, cost them, a fraction of what the first person, because they know exactly where to look. But yet, within families, you can have this identical mutation, yet your symptoms can vary tremendously.
Right.
Yeah, that's the way I understand it anyway, is that, because they know where to look. If one person has it, then they can always go back to that test and go, okay, this is where that mutation is. And if it's in your family, they have it in the same place. That's how I,
And that's something I'd be interested to hear a little bit more about.
yeah.
We're gonna discuss it.
Yeah.
So far, everything you've said is very good.
We'll discuss it in a little bit.
I'm impressed.
Robin?
Well, I was diagnosed, I believe it was 2007, but I started having seizures, partial temporal lobe seizures, shortly after my first child was born. And so went to a neurologist and was diagnosed with epilepsy. And about a year later, going to a follow-up appointment, they actually gave me an MRI, and it came back with some holes and lesions for what they described that as. And I remember sitting at my appointment and saying, oh, well, I guess it's because of my seizures, right? And she said, no, your seizures shouldn't be causing these kinds of holes and lesions. But here's your prescription for Lamictal. And kind of set me on my way. At the same time, my father had started having a series of strokes, and eventually it led to his diagnosis of CADASIL. It's interesting because he actually went to one neurologist, Dr. Paul, had an MRI, and the radiologist said on the report could possibly be CADASIL. And he looked at it and said, no, that's too rare, I'm not even going to test him for it. He eventually ended up with Dr. Beringer up at the University of Utah, and he was given a test and tested positive. At the same time, they were getting ready to test me for MS, but once they found out that my father tested positive for CADASIL, then there really wasn't much need to be tested for that. So I was tested about a year and a half later after my father was diagnosed, and so far I have seizures, and I think I definitely deal with some anxiety and depression issues. I've noticed it affects the way I'm able to get things done, and before I was even tested, so I started having seizures at about 22. I would say at about 26. Over the course of a couple months, I really felt quite a decline in the way I felt physically and emotionally. And I remember thinking, something's going on, but I didn't even know how to explain it, or, So that's kind of where I've been. On a side note, I wanted to say my little sister, who's obviously not here, who has tested for CADASIL, positive for CADASIL as well. I think it was maybe 2 years ago. She had her first child, and had kind of a mini TIA stroke right after she had, within minutes of having her baby. And so they gave her some tests and things, and she has a PFO as well. And she's trying to decide right now whether or not to have it fixed, or.
Well, they do say there's about 25% of the population has a PFO.
Yeah,
so
yeah.
you gotta keep that in mind.
In mind.
And don't know it, or do know it.
Are your sister also
May not
tested
know it.
positive?
Yes,
Okay.
You don't
she
know
has
it,
tested
unless you have an
positive.
echocardiogram.
So.
Todd, did you want to?
Yeah, I'm Todd, I'm Robin's brother. I have not been diagnosed yet, but I've been having migraines ever since I was 14.